Hello and welcome to GBMC on Facebook Live. I'm Don Scott. With me today is the Vice President of Human Relations, HR as we call it, Anna Maria Palmer. Welcome.
Hi, Don. Thanks for having me.
Nice to see you. And I'm sure we're going to have a good conversation. We had talked about this, about jobs.
Right.
And they're so important this day when so many industries are going down and others look like they're coming up, and not everybody can do high tech, right?
Right. That's right.
Now, I've got to tell you, I volunteer at GBMC, and I have my life before hospital and after hospital. Before hospital, as a layperson, I'm driving by what always is a nice campus, and I'm thinking, okay, there are doctors there, there are nurses there, and there are technicians. And that's it. There are no other jobs, nothing I could do at a hospital. Not true.
That's correct. Not true. There are so many opportunities. Most people think of doctors and nurses when you think of a healthcare system, but we have a broad continuum of needs and jobs, everything from the traditional accountants and human resources folks to housekeepers and as well as secretaries. So it's like any other organization delivering a service.
And in this time when jobs are a premium, is there turnover in the healthcare business, or is everybody in it and set?
Well, there's a lot of growth in the healthcare business, and so there's lots of choices that people that have healthcare experience can make. There's a lot of job choices. It's very much a growing industry. As we were talking earlier, I had mentioned that in Baltimore County alone, we've grown healthcare jobs by 34% since 2001. It's really pretty remarkable, and the growth is continuing. The statistics from the Baltimore County Economic and Workforce Development share that we're going to continue to grow another 10% in healthcare jobs by 2024. So that growth really, is creating lots of opportunity and lots of choices.
So a lot of people should focus on that. What if I was in high school right now and I wanted a job in healthcare, and again, I'm not going to be a doctor,
Okay.
I'm not going to be a nurse, and maybe I'm not going to be a tech.
Right.
What do I look for?
Well, there's lots of jobs. What I encourage young people to do is take advantage of some of the volunteer opportunities that we have, not only at our hospital, but also throughout our health system. And by volunteering, you have an opportunity to shadow and to see some of the different jobs and opportunities that are out there that may direct you one way or the other on a career to pursue.
I don't know if you have a list of job titles in your head, but let's doctors, nurses, technicians.
Okay, and it goes everything down. We have roles that are called sitters, and these are individuals who may sit with a patient who may need to have extra help getting in and out of bed. We have roles called transporters. These are individuals that help us transport our patients in wheelchairs throughout the hospital if they need to have different services in different parts of the hospital. We have employees in our gift shop. We have employees that are helping us administratively with billing, with accounting services. So it really is a broad continuum.
Okay, and in large part nowadays, when you hear of an industry that has a lot of jobs available, you think of your big box stores, and they're paying minimum wage, which some sources say you can't live on or raise a family on. Are we talking about minimum wage jobs for the most part?
No, our jobs are all significantly above minimum wage. And of course, from an employment perspective, what we like to focus on is really what we call the total rewards of working in healthcare. So in addition, of course, to a wage that is significantly above minimum wage, we also provide benefits to our employees: medical insurance, dental insurance, tuition reimbursement, paid time off, are just some of the things we're able to provide.
Now, if someone says, I don't want to do college,
Right.
but I'd still like to work in healthcare, is that possible?
That is. It is very possible. As I mentioned, roles like our transporter roles, and then we have other roles that may require some type of skills training or career training, like medical assistants. We're fortunate in that many of the Baltimore area county high schools have programs for nursing aid type programs in high school, as well as our community college system has programs for medical assistants.
Okay. Do you provide training for people? I mean, if someone, I'm not sure how someone comes in without any training
Right.
and gets trained, but are there positions that you do that for?
Yeah, there are. We have a nurse education office that helps us provide continuing education, continuing training for some of our staff, and then also, provides training around some of the basic skills we need to have around, hand washing and hygiene. So yes.
Since I've been a volunteer,
Yeah.
I pay attention to the signs
Exactly.
where
Good, good.
employees and volunteers must
Good
wash their
question.
hands before going back to work.
That's right.
In the training aspect, I guess, I was going to go more on that. If I want to get an outside education and I'm already an employee or a prospective employee, do I get tuition assistance?
We do. We have a tuition assistance program that reimburses employees up to $5,000 per year for attending a college degree program. But more importantly, we also have professional development funds in our different department budgets so that employees can participate in seminars or other types of non-degree programs to further their education.
Okay, let's say we've piqued somebody's interest out there. And
Okay.
they're on their computer, they're watching us on Facebook Live. Is there a place on gbmc.org that you can apply for a job or
There
see what
is.
jobs are available?
There is. I'd encourage anyone to go out to www.gbmccareers.org,
Okay.
or you can go right to our main page, which is gbmc.org, and click on the Careers tab, and there you will see about 200 jobs that are available throughout our healthcare system.
And you can apply.
You can apply
the
right
ball-
online.
Get the ball moving.
Correct?
From there.
Absolutely.
All right. The other thing I hear about from every place in the healthcare industry is the nursage shortage, the national nursage shortage. I think as many nurses get turned out in this town as new lawyers do each year with the teaching hospitals. How can there possibly be a shortage of nurses?
Well, there are, because as I said before, that just the sheer growth in healthcare and in everything from not only hospitals but also hospice, and I'll want to talk about our Gilchrist hospice services. We're the state's largest hospice provider, and as a result of some of the quality care we're providing, we've seen an increased need, and we're fortunate for our services, which in turn causes us to go out and hire more nurses, more hospice nurses. So yes, nursing, there is a nursing shortage, and it's something that we focus on, every day throughout our healthcare system.
Okay, one thing I've never understood about nurses: LPNs, RPNs.
LPNs and
RNs,
RNs.
thank you.
RNs, that's okay. That's
extra
right.
P.
So that's right. So yeah, so we have, we do hire some LPNs predominantly in our Gilchrist hospice area, but we predominantly hire RNs. The state of Maryland recently has a new requirement that by 2020 in acute care, our RNs, registered nurses, must have a Bachelor's of Science in Nursing as well as an RN. So 80% of our nurses by the year 2020 must have a Bachelor's of Science in Nursing.
Do you think that's doable?
Well, we have 3 years, so they have 3 years to achieve that, and we're, certainly being as supportive as we can to enable that in our health system.
Okay, you mentioned hospice, and
Yes,
you'd like to talk
yes.
about that. To a partial insider looking out,
Yeah.
they're two separate places on the campus.
Correct.
And I didn't realize it was the largest hospice, but tell people what a hospice is and how it differs from a hospital.
Okay. Well, a hospital is providing care so that individuals, our patients, can get better, get well, and go back to, the life's activities they've had prior to entering the hospital. The hospice is, a program where we are helping prepare our patients for end of life. And it could be end of life at any age, unfortunately, but we have nurses and doctors and palliative care specialists who are helping, patients prepare for end of life. We have several inpatient units, obviously the one in Hunt Valley on the campus near our hospital, but also Joseph Ritchie House in Baltimore City, as well as an inpatient hospice in Howard County. And then we have hundreds of home health nurses that travel to our patients' homes and help the frail elderly as well as help those who may be, in hospice. So large need for that. At this point, we have about 825 hospice patients in our care every single day throughout the greater Baltimore area.
Wow.
Every single day. And so, shouting out for hospice nurses is something that we're doing often. And I'd really encourage folks to become a part of our GBMC hospice nurse program, both at our inpatients like Joseph Ritchie, but also home health, and traveling in Howard County, Harford County, and Baltimore County.
I've had the opportunity to talk to many hospice nurses and other people who work in the hospice, and they say they wouldn't do any other thing.
Right.
And again, from the outside looking in, it's got to be a hard job emotionally. So do you pre-test people, or do you question people about it?
Well, obviously we have, a thorough interviewing process. Working in hospice, like working in healthcare, is what I call mission-based. There are certain individuals who, who thrive on mission-based employment, and our mission is to help others either through providing quality care or through preparing them and their families for end of life. And so mission-based, compassionate people do very well working in our healthcare system.
Okay. Do you have people who come into the hospital, let's say, and want a job, but say, I don't like blood, sick people scare me.
Right.
Is this the place for me? No.
Sure. Well, actually, as I mentioned, the great thing about being a comprehensive healthcare system is that we have lots of what we call healthcare support jobs, healthcare support roles. When you think of healthcare, and just to share with you, Maryland is a very rich healthcare town, healthcare state. Baltimore County's a very rich healthcare state. There's about 53,000 employees in Baltimore County that do nothing but work in healthcare. And that includes everything from the folks that are doing patient access, helping to schedule patients, to the administrative support, the billing agents, the folks that are working on customer service, our customer service representatives. So there's lots of what I'll call behind the scenes roles that really help us in the end deliver the quality care.
And I have to once again interject. I've been volunteering at GBMC for over a year now.
That's great.
I've never seen any blood.
Okay, good, good.
I'm in the lobby.
Good.
Good. I do see a lot of sick people, and when you approach them in a helpful manner, they are the most responsive and give you a gift that you think you're giving them.
Right.
So I just wanted to emphasize.
It is. It's very gratifying. It's a gratifying place to work, to know that you're providing a service to someone who at that moment needs additional care.
A couple times you've mentioned the word independent.
Yes.
And when you said healthcare state, I have to admit I started thinking about Obamacare and that
Right.
governmental things. But GBMC and Gilchrist have no government connection?
Well, no, GBMC and Gilchrist and GBMA, which is our physician practices. We also have a unit of our healthcare system that has 40 plus physician practices throughout the Baltimore County area, in addition to Gilchrist. And then, of course, the hospital. We're an independent community health system. And so, what that means is, we are not a large statewide system. We are a community health system providing care in our community of northern Baltimore County and Baltimore City and Howard and Harford counties.
Why is it important to me as a patient?
Well, as a patient, the great thing is we are not, a very large bureaucratic system. We have, great access to, some of the best docs in our area, and also great access to the leadership of the healthcare system, because we're all based right there in Towson, Maryland.
As a prospective employee, what does the independence mean to me?
Well, it means that our organization, while we are a nonprofit organization, we are owned by our community. We are not a part of a large multi-state, multi-bureaucratic system, and we pride ourselves on our agility and our access for our employees and our family members, to dialogue with us about how to be the best healthcare system in the community.
You mentioned GBMA.
Yes.
All those outlying satellite areas.
Correct.
If I get a job at a doctor in the satellite area, do I get the same benefits as somebody who's at the hospital?
You do. We have the same benefit program throughout our entire healthcare system. And even more so, a great thing is from a career progression, Don, you have the opportunity to move within our healthcare system through our internal job posting program. So you may start out working as a medical assistant at one of our physician's offices in Jarrettsville, and you may see another role where you might want to be a patient care coordinator at Gilchrist, and yet another role where you may want to move into the finance function in our financial division. So one of our HR staffers herself started out as a volunteer and then a transporter, and then while she was going to school, furthered her education and joined us in the HR team, all without leaving GBMC Health System.
Amazing. You're not pigeonholed in any way, shape,
No,
or form.
not at all. Not at all.
How about if my wife has a job there and I got a job that I'm not really happy with, and I'm thinking about going through the list on the computer, but I figure GBMC doesn't want a couple working there.
Well, actually, we do have family members that work throughout the system. We have over 3,000 employees throughout our network, and so because we do have different units in different divisions, it's not uncommon to have family members. We, of course, won't allow family members to be in the direct chain of command of each other. But short of that restriction, we're interested in getting the best qualified person for the role, regardless.
Okay, when we were talking about being an independent hospital, I think I heard the words not-for-profit or nonprofit go by.
That's correct.
And from an outsider point of view, how does an organization the size of GBMC or any other hospital that's not nonprofit, how do they exist? You got to be making money.
Well, sure we are. So generally a nonprofit exists to provide some service that's in the public's interest. In our case, the public interest is healthcare. And so GBMC exists to provide a public interest in healthcare, and its profits should be used generally as a nonprofit to reinforce and to be reinvested back into the system. And so unlike a for-profit company where profit dollars are typically generated to pay shareholders or stakeholders, our profits are generated to help us continue to reinvest into GBMC through equipment, medical technology, and that's how we're classified as a nonprofit.
Let's get as a layman, you hear nonprofit, you figure, okay, it's going to be practically free.
Right.
And then you get your bill and
you say no.
So I want to be clear on that. Can I talk about your job for a minute?
Sure.
I often refer people to HR,
right,
human resources, but I'm not sure I know what scope you cover.
Okay, so our team, our human resources team, is responsible for providing, full range of services from recruiting and hiring, benefit administration, benefit design, compensation administration, learning and organizational development, providing in-house training, orientation, and development programs, and also diversity and inclusion. We're very proud of the fact that we have really an expert diversity and inclusion staffer on our team that helps us not only educate our employees about each other, but also helps us educate ourselves about diversity in the community in which we serve. We also have a very comprehensive spiritual services program that's a part of human resources, where we have on-site chaplains to assist family members, and also to visit patients of all faiths throughout our GBMC health system. So it's great.
When I came to GBMC, I was surprised that there was spiritual services because it was an independent hospital,
that's right,
not affiliated with any church or any religious sect.
That's correct. So we have a wide spectrum of religious professionals that come to our organization every day across faiths to provide support for any patients or family members of their respective faith. And it's a welcomed part of the diversity of our organization.
So I have to admit, next time I walk by the HR offices, I'll realize that there's a staff of thousands behind that
There
door.
you go. Well, maybe not thousands, but we have a great staff that covers in just really every area you can think of, reaching out to our employees.
Okay, what haven't I touched on that you would like to talk about on this topic of healthcare employment?
Well, we talked a little bit about the employment and what types of jobs, and I can tell you, a great problem to have is as more patients in the community seek out GBMC for their healthcare needs. That's what's really driving a lot of our growth and a lot of our recruiting efforts. And so areas like medical assistance, in the past several months, we've realized, we really are recruiting for additional medical assistance, particularly in our physicians' practices. And again, as I mentioned, hospice nurses and nurses of all types, not only for the hospice, but also for the hospital. So one of the things we've been able to do to really help us is, particularly around nursing, is offering 12-hour shifts. So that nurses have the opportunity to have more time off. Mm-hmm. We do things like 12-hour shifts so they can have 2, 3, sometimes 4 days off. Lets them recharge and re-energize themselves to come back in. And, we're really happy to be able to offer that.
My mother-in-law was a nurse,
Oh.
and she at one point was offered the 12-hour
Yes.
shift and really struggled over whether she wanted it or not. But after she became a 12-hour-a-day nurse, she loved it.
Good.
Because it gave her 3 days.
That's right, her freedom. Exactly. That's great.
I probably haven't mentioned often enough, but of course we are live on Facebook at the
Okay.
moment with GBMC, and we have someone who's asked, Laura, by the way. Thank you, Laura.
Okay.
If I want to apply for a job at GBMC, how long does the hiring process take?
Okay, and it typically depends on the type of role, because as you just mentioned, sometimes when we have 12-hour shifts, the hiring manager may be off, and so we coordinate around the different schedules. But typically, it's a very swift process. You apply online at gbmc.org. Mm-hmm. And then our sourcing specialists will review all of the applicants for a particular job opening. They refer those applicants to the hiring manager, typically within 2 days of the review. And then the hiring managers will review the applicants, notify human resources who they would like to bring in for an interview. And so depending if they're, day shift or evening shift or night shift types of interviews can sometimes affect the scheduling.
And of course, in this modern day, you don't have to quit your current job to start the process for a new job.
That's correct.
At your hospital or anyplace else.
That's correct.
What else haven't we brought up?
Well, let's see here. We are.
We got lots of notes here.
Oh, yeah, there you go. Let's see. Well, I guess I do want to talk a little bit more about just taking advantage of. There are lots of continuing education opportunities in the Baltimore County community. The Community College of Baltimore County just came out with a new catalog this week, and in that catalog there are 10 pages, I counted, of different types of courses or certificate programs or even introductory programs to different careers in healthcare. And so the fact that they are having so many great resources, it's an opportunity for folks who are scratching their head and thinking about a career change for a way to try it out and maybe migrate over time toward a healthcare career.
As you pointed out, it is a growth area.
It is.
As the greatest generation continues to age,
Mm-hmm.
we'll spend more time in hospitals, either ourselves or with our loved ones.
No, that's very true. It's very true.
Actually, it's been a pleasure talking to you. Hope to do it again.
Thank you.
I should mention by Anna Maria Palmer, Vice President of Human Resources for GBMC. Coming up on GBMC Facebook Live, you mentioned spiritual services,
yes.
which I'll practice saying by this time. Next month, I'll be talking about that in this very place and this very time. So,
Oh, great. With Joe Hart.
Yeah.
Yes, our chaplain.
Interesting guy, and interesting to see other members of the clergy come and go and do the work they do. And it's more widespread than you might think, and it shows itself in different ways than you might think.
It does.
I like the rock organ concert we had in the chapel one day. But
great.
as always, thank you for
Thank you,
watching
Don.
us, and we hope to see you again on GBMC Facebook Live when I come back, I think in a month, maybe 3 weeks.
Okay.
Thanks
Great.
again.
Thanks again, Don.
Have a great day.
Thanks.